The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh, and today we're going to be talking about a very serious subject. We're going to talk about sexual abuse and how it relates to children. And this has been a big problem recently in this country and many places around the world. It is a big problem. And today, if you're a young person watching, or if you're a healthcare provider, or if you are someone that just sees something that looks troubling to you, I know you're going to find some things that help. So talking with us today is a psychiatrist from Pittsburgh, Pennsylvania, Dr. Manjula Borge. And doctor, we're just glad you could take the time out of your busy fellowship. You're doing a fellowship now in adolescent and child psychiatry. And I understand there where you are doing the fellowship, they actually have a traumatic center or something that actually deals with this very problem.
Yes, thank you for having me here. And at Allegheny General Hospital, we have a Center for Traumatic Disorders, and we see a lot of children who are abused in different ways at that center, and give them help and give them support. But even when I see patients, I see a lot of children who have been through different kinds of abuse, and it's really, very devastating. Imagine a child who is, growing up and having a developing mind, and the adult's role is to take care of them, to protect them, to teach them, to nurture them. And when this is broken, when this is destroyed, and someone who is in the capacity of helping and protecting the child violates the child in different ways, be it physical, emotional, or sexual. The development of the child is not normal anymore. It goes in several different ways, and children are affected majorly by the different events that can occur. And it's a huge impact that is placed on the developing mind.
Two things while we go through this program today, I just want to say. If you are involved in abusing a child, I hope this program makes you so uncomfortable that you turn yourself in. You need help. If you are someone that has gone through abuse or has experienced that, I hope you find hope and help in the program today. Let's look then at the importance or what the impact is rather of the emotional, physical, sexual abuse. You might want to give some kind of definition, but then going into what the impact is. What kind of damage does this cause?
Yeah, studies have shown that people who are abused, they in turn return and become abusers, from what their experience has been. So, like you mentioned earlier, it is very important to go and get the help that they need so that they will turn out to not, abuse others.
So, in other words, this is a plea for help even for someone that's involved, a perpetrator.
Absolutely. There's a lot of resources. You can go and talk to your doctor, and things can remain confidential, and you can get the help that you need.
So how do we know when someone has been abused? I mean, we don't want to get into all the details, but how can we tell when someone is being abused physically, emotionally, sexually? What are the signs, the warning signs and symptoms?
Yeah, there are several signs. A person who has been abused may not react in what we call normal ways. They might be more irritable, more anxious. Certain things that they do might not be normal. For example, children, if you see them playing, they might not play like a normal child would with other kids. They can also reenact their abuse. For example, if they're playing with toys or with dolls, they might do the same thing that was done to them to that doll or,
Those
you know,
are all
or the toys.
big warning
So,
signs.
yes. So if a child is doing certain things that show that, you know, something doesn't look right here, or why is the child being so brutal or so like killing the doll or killing the you know, the soldier or whatever, you know. So if a child shows symptoms like that, you know, you want to maybe find out a little bit more. It can be something that they just know about, you know, saw from TV or you know, learned about. But you know, one might want to ask if you see certain kind of actions from the child that trigger some kind of suspicion of abuse.
So by beholding, we're changed, and they've been changed by what they've beheld or what's been done to them.
Yes, because a child who is not supposed to know certain things and is exposed to that, you know, will probably show it out in certain ways. And so that can be a warning sign to parents, if it's coming from the family or from the neighborhood, to find out what's going on.
Are there any statistics or any who are the people most involved in abusing?
I think usually what studies show us is people who are known to the abused
It's
person.
not the person that drives down the road, and it's the person that's in their normal life.
Yeah, well, you know, you can have people, you know, even from the street, strangers who, you know, abuse people, who come and
Right.
cause rapes. But usually if it is something that's going on within the family situation, within the neighborhood, if it's usually like a known person, probably a boyfriend or like even a spouse or a parent that can be the perpetrator.
What is the, you know, for a professional, a clinician, someone, a nurse, a doctor, a psychologist, whatever, they're duty bound to report anything they think that's suspicious. I mean, if they don't, they can lose their license.
Sure.
So, you know, they need to do that. A school principal, a teacher, same thing. They need to report that. If they don't, they're you know, they're going to be in trouble.
Yeah.
But what about lay people? What should they do? How should they relate?
I think lay people also should definitely, you know, ask for help or, you know, find out resources that they can get the help from. Because, you know, imagine if someone is going through certain abuse, you want to protect that person. You want to prevent any further abuse. So for a lay person, I think it's important to you can contact any, you know, any mental health resource agency or any kind of facility where you can find out, learn something more. A lot of these places, sometimes they don't even ask, you know, who is the person reporting. So you don't need to be fearful of that. So at least once you report, the authorities can come and investigate the problem and find out what's going on. So I think one should not be hesitant to seek help, to, you know, help somebody who's going through a certain type of abuse. And I think it's important that you don't necessarily have to know if the abuse is 100% happening, even if you suspect it, but you know, you're not sure. You can report it because the authorities will come and you know, try to find out the details of what is going on. So even if you suspect certain, you know, physical abuse or danger to a child or threat to the child's life or sexual abuse, you know, one can report that, and then it's up to the authorities to go and investigate if this is the case or not.
Let's talk about the impact this has on the children themselves. What are the studies showing? What is the impact for these types of abuse, physical, emotional, and sexual? What kind of impact is there?
Well, you know, I tell you, one can just imagine what impact it has on the child. I see a lot of patients who've been abused, and they're, you know, very devastated. People who are supposed to protect them are abusing them, and I think children go through a lot of period of where they mistrust their protectors, and it's not just they mistrust them, they even mistrust other people, like medical professionals and other people who are trying to help them. That trust is lost. They think that, well, you're not going to care, or you're not going to do anything about it, or even if you care, what can you do? That the situation is hopeless. This is happening because of my own loved one. So what can you do? So I think there's a lot of mistrust involved, a lot of feelings of basically like hopelessness, that this is an environment where they're supposed to be protected and kept safe, and this violation is happening to them. So they feel very hopeless. Sometimes they even feel like that nothing can be done. Or if they tell their, say if the father is abusing them, if they tell their mom is going to get more upset and more angry, and so they might as well not tell them that. They might as well not hurt the other parent.
Do sometimes are they unaware that they're being abused? They think it's normal.
Sometimes that could be. If a child doesn't know what.
Proper.
What is right from wrong, they might think that this is something that is supposed to be happening. But I think that if the children when they talk in school with their friends, what is going on, they can find out from their teachers, that this is something not supposed to be happening, and I think they can get the help that they need.
So impact on them is trust, hopelessness, fearfulness, a sense of anxiety, any other impact on
Absolutely.
the case?
It's a lot of physical and emotional impacts. That the child might have problems with physical complaints. They might show it as having nightmares, night terrors, difficulty sleeping. They might become very aggressive with their peers. They might become threatening. They, just like how they are threatened during the process of not to tell anybody or to be quiet about it, they can in turn become bullies at school and be very angry and resentful.
So any drastic change here or building change would cause you to think, man, I need to check this out. What about this? Sometimes people say, well, that child's lying. Do children ever lie about abuse?
Well, sometimes children can do that. Sometimes if a child is upset with the parent for some reason, if they didn't get their way, if they didn't get their allowance, or they were not allowed to go on a date, and they've been probably, let's say, been through a situation before where they were abused, and they got away with, they got the help that they needed, so they might look at this situation as, well, if I just lie, I might get the help and I might be able to do what I want to. So, you can have instances where children
but that's
lie
rare.
about. Yeah, that is rare. Usually, kids who are abused, usually that is going on in the family, and maybe it's not just them, it's probably the other siblings also. It could probably be even the spouse. So,
so you can figure it out by just looking into it. You have ways of figuring out whether or not it's a lie or not.
yes, you can, get more history, more collateral history, and then find out. And then I think sometimes, kids, if they do that and if they lie, they'll come out after some time and they'll tell you that they did lie about it when you're interviewing them. So they, they'll come and say that I did this just so that I could have this, or I could do this.
The perpetrator, the person watching, they probably many times will focus, well, that person's lying, this and that, and they really play that up. And I'm sure that they do that to get around and not be caught. Let me ask this about those who are abusing others. There was a large church organization that unfortunately was involved in this recently. Many people have heard about this, where people in authority were abusing parishioners. Then they'd be shifted, they'd cover it up. And now they're taking stronger measures. I don't know everything about what that particular church is doing, but I do know that some people say there is really a very limited amount of hope for someone that is actually an adult that's abusing people. I mean, they many times don't get over this. You see them, they've been for years in treatment, and then they go right out and do it again. Is there any hope for perpetrators?
Absolutely. I think there is always hope. If one wants to change their ways of whatever they've been doing, be it even if they were abused, a lot of people, like I mentioned, abuse others because they themselves have been abused. And if they look at that as something that, shouldn't have happened to them, or how could it, and, as a way of revenge, taking revenge of what happened to them on others, I think that definitely there is always hope when one wants to, but I think it also matters if you want to help yourself. That is important aspect also, because if you go to the different clinicians and if you go to different people to get the help, and you yourself don't want to necessarily change or be helped, then I think whatever one can do might not be helpful to that person. But if you want to get help or whatever addiction that you have, there is definitely hope. You go to you go speak to your physicians and they can talk with you. I think fear of not getting the help is a barrier that stops people going and getting the help, and also fear of, the consequences of what will happen. But I think one needs to deal with that fear, and one needs to be able to put up with the consequences of what you've done. You never know that while going through that process of maybe some things that you have done in the past will help you make will help you and make you a better person and will teach you. So I think it's very important to go and get the help, and there is a lot of hope for people who hurt other people. And I really hope that if there is anyone in that situation, to know there's a lot of hope and a lot of help out there.
We're talking with Dr. Manjula Borge. She's a psychiatrist from Pennsylvania. And when we come back, we're going to look at some hope and some help. We started to talk about that now, not only for perpetrators, but also for those who have been the recipients of abuse. Join us when we come back.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Diehl and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Diehl and Dr. Ludington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We're talking with Dr. Borge from Pennsylvania. She is a psychiatrist that is now doing a fellowship in child and adolescent psychiatry, and she has to deal, unfortunately, with people that have gone through significant abuse, physical, emotional, sexual abuse. And you've been talking about, the problem, what the impact can be. But now we want to talk about the treatment. We want to talk about help and hope. What kind of things do you as a clinician do? What can we do? What can those listening do to get the help that they need? Now we're talking not about the perpetrators, although we talked about that a little bit, but we're talking about those who have been abused.
Okay, well, actually, when I feel very privileged to work with people who have been abused and have been violated. And I think that being in a position where I can be help and support to them, I think it just makes me very happy. I feel like I feel fortunate to be in that position to work with people. Yeah, so what can people who have been abused, what can they do about it? I think number one is, going out there and seeking help. I think that's an important step that one can take. Because if one stays with the guilt and all the suffering that they're going through and feel that there's nothing that they can do about it, or it's just so impossible, I think that's huge
Even
problem.
more devastating.
Absolutely. So if you go out there, because if you don't know what kind of help is out there, then I think you cannot be benefited from it.
So let's say you're a 5-year-old, you're a 7-year-old, you're just one of these little children. Tell someone, tell an aunt, tell an uncle, tell someone, go get some help.
Sure. If the unfortunate situation, if it is happening with your own parent or parents, you can tell your family members, or you can tell your school teacher.
Your pastor, your school teacher, just tell someone.
Sure. And I think that is a very important step one can take in healing themselves, by going and seeking for help, by telling someone. That just opens a huge area of where you can be, get help and be supported. So I think coming out with that and asking for help is important. Now, you don't have to explain exactly the details, because once you ask
for help,
yeah,
they'll get to that.
Sure, they will refer you to the right person. So you might not want to explain the whole details if you don't feel comfortable with that person. But at least if that person can hook you up with the right facility to get the help, then you can go and discuss that with your psychiatrist, who will keep things confidential. But of course, like we mentioned before, in cases of abuse, confidentiality has to be breached, because the right authorities have to be informed, so that this will be prevented from further happening.
You talk about seeking support within the community and within the family. Of course, the family's involved. Sometimes that's not possible, although an extended family member. But what kind of things can a community do, or a family that's not involved do, to support someone that's gone through abuse?
I think community is very important. And as community, I think we need to be not judgmental. We shouldn't look at the person and start saying that, well, it's probably because of how they were, or their bad behavior, or different things that they've been through.
Blame the person who's abused for their abuse is not good, is what you're saying.
Yes, yes. We have to be very, we as a community, as Christian people, we need to be very supportive of the people who have been through difficult situations. We need to understand where they're coming from. Sometimes they can be upset with us, when we're trying to help them. They might be rude to us. They might be like, okay, why are you trying to do this? I don't need your help. And I think we as Christians need to understand that, and we need to be supportive, no matter what kind of response we get from that person. Because once that person starts seeing that you are understanding of them, even though they were, mean or rude or abrupt with you, that builds trust. That builds trust, and then probably they're able to open up more to you and get the help that they need. So being supportive, being understanding, is, no matter how the person reacts to you, is very important.
So a listening ear from an authority figure, because their authority figures have been abusing them, and they need to have reestablished a confidence in a person and that's in a position of authority.
Sure. Sometimes, we just need to listen. We just need to not say much and just be there and listen. That is also very important.
What specifically should we avoid? What are the taboos? I mean, you said judgmentalism and some of these other things, but are there any other things to avoid?
Jumping to conclusions, like I said, where you think that, this person is not saying the truth because of how they are, because of their history of lying, so they're probably not saying the truth. You don't know that. So you need to make sure, and you need to get the right kind of help, so that people will investigate of what's going on.
Okay, for the person that's been abused, 5, 7, 8, 10, 12-year-old, whatever, is there hope?
Absolutely.
We're talking about getting help, but what's the hope? Yeah.
Once again, there is hope. Once you talk with somebody, or the right professional, or another clergy or whoever, you need to realize that it was not your fault. It was not their fault of what has happened. So once the people are able to realize that it was not their fault, and they don't need to be dealing with all that guilt and resentment and hurt, so that opens up a new, whole new ways of healing. Mm-hmm. And once you are able to do that for yourself, once you are able to forgive yourself and the person who has done that to you, I mean, that just is such a huge healing process.
So forgiveness as a psychiatrist, you're telling me that forgiveness is important.
Yes, forgiveness is very important. If you don't forgive, it breeds a lot of hatred, resentment, anger, and all of this anger turned inwards is depression. And then you turn that all inside, and then you get depressed, and you suffer worse consequences, or you suffer some consequences of all that, build up inside hurt and guilt and anger. Whereas if you are able to free that and forgive that person who has done that to you, you find a new hope. Which it's indescribable. You find that new hope, new reassurance that you can go on with your life, you can go on to have families, to have kids, and be supportive of them, rather than abuse another person like you've been abused. So you can be able to do that once you forgive someone who has done that to you.
Now, you've talked about some exciting studies as well. I want you to talk about those. But first, two things I want you to talk about. First of all, setting boundaries with the person that has abused you. And then secondly, resilience, the good news about resilience.
Yeah, I think it's very important. I think the person who is abused is usually afraid of, going and telling authorities, thinking that they will get in some kind of a trouble. And, it'll become worse because if this is coming from your own parent, let's say. And I think that it is important that a person who's being abused realizes that it is important to do that, because if you don't do that, then you're not going to be able to get out of that situation.
Right, and the boundaries not necessarily are set by you. I'm not saying that, but you turn them in, and the people that are professionals will set the boundaries. Sometimes they put people away. Sometimes they do this. But being comfortable with the fact that there needs to be boundaries set.
Absolutely. Sometimes they can, children who are being abused need to realize that maybe if it's going on within the family, and maybe if the other parent is not going to be supportive, that there are, foster homes, there are group homes where the child is taken out for a period of time and kept in a safe environment so that the abuse will not continue.
Resilience. Quickly about what's the hopeful news with resilience studies?
Being knowledgeable about what has happened to you, and that it shouldn't have happened, and being able to realize that, being able to forgive the person is very important, and that this builds resilience in a person.
So the forgiveness is key.
Absolutely. It is very key. It is very freeing. It frees you from the hatred, the guilt, the anger that you have against this person. It not only getting help for yourself and forgiving yourself, but forgiving the person, brings out a whole new area where you feel very freed and very positive, and are able to move on with your regular life.
We've been talking with Dr. Borge. She's a psychiatrist from Pittsburgh. Thank you so much for joining us.
Thank you.
I want to close today with a Bible thought, and it's found in Ezekiel 18. It talks about someone who's gone through a traumatic situation. It says this: he sees all the sins that his father has done and considers them, but does not do likewise. We hope that if you've been through a traumatic situation, you'll be able to consider it and understand it, but by God's grace, through His power, through the right help, you don't have to do likewise. May God bless you today.